My name's Karede, first-year medical student. So you talked about your communicating with the different provinces and negotiating several different outcomes and things of that nature. Would you be able to just give me one or two of those outcomes that you'd be looking at?
Sure.
Yeah.
No, it's a great point. I mean, one of the things that we knew going in to these healthcare renegotiations is the federal government was not going to be dictating how many nurses need to be on duty in a given ward at one moment, or how often a day you should be changing a bedpan, or what kinds of delivery models need to happen in healthcare. Because different provinces will have different ways of solving the same things, and quite frankly, provinces have the expertise on delivering healthcare, not the federal government, so who are we to say that anyway? But our job is to make sure Canadians are getting the right services, the right healthcare across the country. And the way to do that is to really focus on outcomes. So those 4 areas we chose: access to family doctors, better access to mental health care, more support for healthcare workers and therefore a reduction of wait times, and better data, are all things that as those get improved, the results throughout the system will improve. If we're handling mental health better, well, that helps not just the healthcare workers, but it helps patients, it helps communities. If people have access to family doctors that and primary care teams, that really helps significantly as well. So there's a lot of pieces of that go together. However, one province might be at 90% access to primary care physicians already, and another might only be at 70. So they will balance it differently. So part of what the negotiations are with the provinces right now is saying, okay, what is your target that you want to reach for access to primary care? Are you going to aim for 80% access? You're going to aim for 90% access of the citizens in your province, residents of your province, accessing primary care. So we will say, okay, you're going to get to 90. That sounds reasonable. This is the path you're committing to get on. This is what the interim goals. Great. That'll be part of the deal, and that's the chunk, one of the chunks you're going to use of the billions of dollars we're sending. What do you want to do in terms of mental health? How much? Maybe it's wait times. How long you expect someone to get once they call up in crisis? You can't say, okay, we can get you an appointment with a psychiatrist 6 months from now. And first, like, I'm in crisis now. I need help now. Like, how are we doing that? So getting those metrics down in a way that is appropriate and chosen by the province. Now, if one province says, yeah, we're going to try and get 70% coverage on primary care doctors, and the province next door is saying, yeah, we're getting 90% coverage, I think citizens and residents will be like, wait a second, access to primary care is something we absolutely need. So what we're asking for the provinces is to set those targets that they want, and then hit those targets, make them publicly accessible so that they are accountable not to us, but to their residents, to their citizens, and people will have the information, have the data to know whether that's being hit or not. And if other provinces are able to do it with similar pots of money and they're not, well, then there's questions around leadership or allocation of resources that have to happen. But it's not about the federal government demanding specific outcomes. It's about empowering citizens and unions and healthcare professionals and experts and academics to say, yeah, we're not hitting this and we have the data to show it. Because right now it's really hard to get that data. We can't compare apples to apples across the healthcare system. But thank you very much for your questions.